Taxpayers want to be safe. Taxpayers want to know that our government is prepared. In this case, we leave no stone unturned in ensuring today that America is planning for tomorrow. Beginning in March 2014, in the West African nation of Guyana, the world first learned about yet another new outbreak of the Ebola virus. Due to poor detection, it is possible the outbreak started late last year. By August, Ebola had spread to Sierra Leone, Liberia, and Nigeria. According to the U.S. Center for Disease Control and Prevention, the 2014 Ebola epidemic is the largest in history, and sadly, the virus has claimed at least 4,000 lives to date. By the end of September, the CDC confirmed the diagnosis of the first travel-associated case of Ebola in the United States. The situation is rapidly developing and changing, and Americans are understandably worried about their government's response to the outbreak, and in particular, the steps we are taking to contain the spread of Ebola. With the high fatality rates as much as 70% and no FDA-approved vaccines or medicines, Ebola is a serious threat to public health around the world. An outbreak in an American city or any major city of the world could be very costly to contain and could have major economic impacts. Yesterday's news was a doctor in New York City tested positive for Ebola, and this is particularly distressing. There is certainly some good news to report on our effort to contain the outbreak. No new Ebola cases have been reported in Nigeria in 46 days. Over 40 people who came into contact with the Ebola patient Thomas Eric Duncan in Dallas have now gone through the 21-day monitoring period without demonstrating any symptoms. And perhaps that means that our preventive systems of those in contact is good, even though, as we will see today, not perfect. We have the world's most advanced healthcare system, undeniably, in America. We spend the most money to have that system. And as long as our response is well coordinated and officials use common sense, there is an ability to contain this disease. But we are not out of the woods yet. Today we will examine efforts to coordinate Federal agencies tasked with responding to Ebola outbreak. This examination follows a series of statements and actions that have eroded public confidence in our response. An infected traveler from Liberia made it through the Department of Homeland Security screening and arrived at international travelers and into the Dallas-Fort Worth area. When the same individual exhibited clear signs of Ebola, symptoms of Ebola, a hospital turned him back into the community and offered an evolving account of how this happened. Without evidence, the director of the CDC declared that a nurse at this hospital who became infected with Ebola must have contracted it through, I quote, a breach of protocol. Medicine is not done over the telephone. It is not done over the television. Medicine is, in fact, the business of looking at a patient, evaluating a patient, measuring a patient, and questioning a patient, not, in fact, guessing how someone became a patient. A separate nurse who contracted Ebola at that hospital was cleared by the CDC to board a commercial airline flight, even though she reported having fever and contact with the patient, Mr. Duncan. The news of that medical doctor returning from Guyana the news that a medical doctor returning from Guyana now has tested positive for Ebola has raised even more questions about procedures in treating patients and risk to Americans responding with great courage and generosity from here to the infected areas. We need to know why there have been breakdowns in it and if our system for responding to such serious crises is working properly. That was a line I was supposed to read I think we all know that the system is not yet refined to where we could say it is working properly. How effective are our efforts at containing the disease in West Africa? Are the training and equipment that frontline healthcare workers and military personnel received in the past or will receive in the future adequate? Is an airport screening that went into effect 2 weeks ago reliable? Are government agencies doing everything they can do to foster the development of Ebola treatments? What threat does Ebola pose to international trade and Americans traveling abroad? When a situation like this arises, government is supposed to rely on prior planning and rapid, effective response that can identify mistakes quickly and correct them. Congress has recognized and considered the threat of an outbreak on a bipartisan basis. The bumbling we have seen comes despite concerted efforts by Congress to ensure protocols and funding were in place to avoid the very mistakes we have already seen. President Obama's appointment of Ron Klain to serve as the Ebola czar, sadly, in my opinion, shows the administration has on one hand recognized the missteps and on the other hand is not prepared to put a known leader in charge or, in fact, a medical professional in charge. That does not make it a political decision, but it makes it a decision in which we have to ask, and we will ask today, is the interagency coordination already in place and he is simply overseeing it, or in fact are we expecting Mr. Klain to put together interagency coordination, to show the leadership to make it happen, to sift through conflicting claims that science and medicine have already reached conclusions versus the reality that those conclusions, at least in several cases, have proven wrong. We did invite President's new czar, Mr. Klain, to testify, and we are very disappointed that he was not able to. But we understand he has just started, and we do not expect that that would be repeated if there is a follow-up hearing. Let me just say, in my role in this committee and others, I have traveled to the World Health Organization's headquarters. I have seen them saying to us as visitors that pandemics are in fact already planned for. And although they talk about the inevitability of a pandemic, we have also invested as Americans billions of dollars to in fact be prepared for them. Let me just say before anyone pulls the trigger on either a political or denouncing medicine, that in fact this is not a new problem. Nearly 100 years ago, in 1918, 1919, the influenza pandemic known as the Spanish flu killed more people than any other outbreak of disease in history. It claimed at least 20 million people around the world. In that pandemic, an American base, one that I was stationed at, Fort Riley, Kansas, proved to be the source of the first known outbreak. The flu spread fast around the base and other bases and eventually worldwide. Famously, the Big Red One is well aware that not only was the outbreak critical, but in fact soldiers were put on ships and sent out from there, further not recognizing that in fact we were simply adding to the disease and the suffering. The Asian flu of 1957-58, which originated in the Far East, spread to the U.S. and caused at least 70,000 deaths. The Hong Kong flu of 1968-69 also spread to the United States and caused an estimated 34,000 deaths. It would be a major mistake to underestimate what Ebola could do to populations around the world, and any further fumbles, bumbles, or missteps, or relying on postulates, certainties told to us by people who in fact cannot defend how that certainty came to be, and when it fails to be correct, how they could have been so wrong, can no longer be tolerated. I look forward to hearing from this panel of witnesses in an effort not to solve a problem, but to take the problem appropriately seriously, recognize that what we don't know could kill us. And with that, I recognize the Ranking Member for his opening statement.